Methodist is guided by its mission, vision, and values. The mission is for Methodist hospitals to provide compassionate, quality healthcare services to all those in need. The vision is to be the best place for employees to work, the best place for patients to receive care, and the best place for physicians to practice medicine. We have 6 pillars: safety, quality, patient experience, relationships, growth, and stewardships. They're supported by the values of the organization. We're an I Care value organization. I Care stands for integrity, compassion, accountability, respect, and excellence. Methodist is nearing 100 years of service to Northwest Indiana. We're extremely proud of the service that we provide to our communities. We're made up of 3 main campuses: Gary, our North Lake campus; Mid-Lake, our outpatient ambulatory center; and Maryville, our South Lake campus. We now have 4 Care First locations. Care First is our immediate care centers. Those locations are in Maryville, Crown Point, Schererville, and the recently just opened Valparaiso location. Methodist is comprised of 500 physicians and allied health professionals, and we have approximately 2,200 full-time employees. As mentioned, we're coming up on our 100th anniversary. This is a special time for our organization. As you can see, it was founded in 1923. So as we come upon 2023, that's 100 years of service to our communities here in Northwest Indiana. This is a picture of the location in Gary, Indiana, of the Methodist Episcopal Hospital, again opened in 1923. Here at Methodist, we're proud of some recent accomplishments. We aspire to excellence with our CARF accreditation. This relates to our rehabilitation program. We are a Magnet recognized nursing organization. Magnet is the highest level of nursing professionalism. And we're proud of our relationship with the American Heart Association, Get With the Guidelines Gold Plus program, where we were on the honor roll for stroke. These and a number of other areas relate to the high quality that we bring here at Methodist hospitals. Some additional recent accomplishments when we think about our ability to provide great care to our communities. Our Heart and Vascular Institute, we have a recent partnership with the University of Chicago in cardiothoracic surgery. That is coming here at the beginning of 2022. We instituted the Da Vinci XI robotic surgery program in 2021. We've done over 100 cases with our new robotic surgery program. And we've expanded into more complex gastroenterology within the organization. Continuing on, our Neuroscience Institute was certified thrombectomy ready. This is an important step in our journey towards comprehensive stroke here at Methodist hospitals. And we saw this year with a new Gamma Knife, we've seen our volume significantly increase. And Gamma Knife is the highest level of cancer care that can be provided. Our Oncology Institute, proud of the Chemotherapy Infusion Center that will be coming in 2022. This will allow our patients to receive their infusions within Methodist hospitals. And in partnership with our Methodist Foundation, we were able to acquire 2 patient simulators for advanced training in our women's and children's service areas. They are Dory and Tori, so a mother and a baby that allow our nurses to go through real-life situations in a labs scenario with simulators. Orthopedic and Spine Center began a same-day total joint replacement program. Very successful start to that program here in 2021. We've seen significant volume increase within orthopedics and our partnership with a new independent group in the area led by Dr. Pomponi. And our sports medicine program continues to grow. We've partnered now in 8 local high schools and with a number of local professional teams, such as the Gary South Shore Railcats. Again, something I mentioned earlier, but our Care First locations, we've opened our 4th location. That location in Valparaiso opened on November 15th. And at a number of our Care First locations, we're proud to be providing both COVID-19 testing and vaccinations. Those are located right now at our Schererville and our Crown Point locations. I'll now transition into an important topic where we're going to review a breakdown of healthcare costs. Healthcare spending has been a significant topic here in the United States. As you can see by the pie charts, the net cost to the U.S. government is $5.1 trillion. And here we provide a breakdown by percentage of where that spend goes. On the right-hand side, we have national health expenditure highlights. So again, a breakdown in a slightly different form of that $5.1 trillion. But you can see a number of the services, a percentage breakdown for a number of those services. So when we look at that, you can see hospital care makes up 36% of that $5.1 trillion. For example, retail prescription drugs make up 12%. Home health care makes up 4%. Those are just some examples. A breakdown of the hospital dollar. Nearly 60% go to wages and benefits. That is the number one expense item for our organization. It's in the human labor. Employee wages and benefits, as mentioned, constitute the largest percentage of cost for inpatient hospital services. And you can see the breakdown in the chart that's provided. Another area, drug prices are increasing faster than medical inflation. You can see on the chart provided that the spend has an 18.5% increase from fiscal year 2015 to fiscal year 2017. We've continued to see, again, that outpace medical inflation. We talked about the fact that the government has a spend of $5.1 trillion on an annual basis related to healthcare costs. There are 2 major components within the government that are responsible for that spend. They're referred to as Medicare and Medicaid. Medicare is a health insurance program for people age 65 or older, or people under 65 with certain disabilities or conditions. Medicaid is a joint federal and state program that assists with medical costs for people with low income. An important fact is that the U.S. government acknowledges that Medicare and Medicaid do not cover the cost of providing care. Continuing on with a description of the underpayment to hospitals, Medicaid only pays for 23 cents on the dollar for the hospital's expense related to the cost of care, while Medicare pays 87 cents on the dollar to the hospital for the expense based on the cost of care. What this means is that hospitals have an underpayment of nearly $800 million. We feel it's very important for there to be additional discussions, especially around this very low Medicaid rate. Approximately 43% of all Indiana births are to Medicaid beneficiaries. Methodist has a heavy reliance on government payers. As you can see with the chart displayed, Methodist Hospitals has approximately 84% of its payers that relate to Medicare and Medicaid. You can see that compares consistent with urban facilities, while significantly different from suburban facilities. Methodist Hospitals has approximately 10% of its payers that are considered commercial. And in addition, we have 6% of our payers that are considered self-pay. This contributes to the need for Methodist to be an extremely efficient organization in our ability to manage stewardship. Here at Methodist, we have a commitment to transparency and affordability. Transparency is a priority. As you know, having knowledge, especially around healthcare, allows you to make decisions based on the information so that you can feel that you're making the most informed decision around care. Please visit our website, which will have transparency around pricing for common services. Click on the price transparency and feel free to scroll through that within our website. In addition, you can always ask us for an estimate of cost. Click on the Care Estimate tool, again within that price transparency page, and you'll get assistance in being able to form an estimation. Visit the website mycareinsight.org to compare hospital charges and quality ratings. And as always, be sure to contact your insurance company to learn exactly what you will pay out of pocket based on your insurance. Methodist is proud to offer a number of financial assistance programs. It's important for us to inform the community about these programs. So again, if you believe that you may qualify, you'll be able to make an informed decision. Financial assistance policy that provides support for medical care is based on a sliding scale. We have financial counselors that will assist in applying for assistance either through the HIP 2.0 program and or the Affordable Care Act marketplace. Those same financial counselors can also assist with Medicaid enrollment. And we're proud to partner with the Chicago Bears on our No Women Left Behind Bears Care program. This is a significant program that allows us to subsidize mammography. Again, it's important for you to have an understanding of the financial assistance programs that are available here at Methodist hospitals. We are committed to reducing costs. Methodist is fully committed to making healthcare a more affordable asset within the community. We are actively engaging in a number of efforts to reduce costs. Some of those efforts include initiatives to improve quality of care by reducing hospital-acquired conditions, improving our CMS Medicare value-based purchasing performance. This allows us to increase Medicare rates and avoid potential penalties. We have a number of initiatives and efforts ongoing to reduce overall costs related to equipment utilization and or purchases and the supplies that are used within your care. We continue to negotiate with insurers to obtain the best possible price on drugs and procedures. Methodist is considered a safety net hospital system. Within that, we have an opportunity to participate in a 340B drug program. That 340B program allows Methodist, through our outpatient pharmacy, to acquire drugs at a discounted price. We're able to then use the proceeds of that program to, again, continue to support community initiatives that are committed to reducing healthcare costs within Gary and Maryville. Now let's talk through economic impact and some challenges for healthcare systems. Some economic impact that Indiana's hospitals have on the overall economic position for Indiana. Hospitals are an economic engine. They are significant contributors to Indiana's economic health. They are major employers and significant purchasers of goods and services. As you can see on the slide provided, there's approximately 245,000 jobs generated throughout the state of Indiana by hospitals, and over 113,000 directly employed by Indiana hospitals. That direct and indirect impact on Indiana is very significant. As you can see, payroll comprises almost $26 billion annually. Supply purchases are approximately $18.3 billion annually. And capital spend by hospitals equates to approximately $3.8 billion annually. This has a total economic impact in the state of Indiana of over $48 billion. Now let's look at comparison between Indiana business versus healthcare rankings. This slide, I think, shows a significant gap between how Indiana rates from a business community to a healthcare community. And we have a long way to go when we think about the healthcare community here in the state of Indiana. For example, the cost of doing business in Indiana ranks number 1, while public health funding ranks number 48. Again, the state infrastructure around business ranks number 1, while Indiana ranks number 41 at the percentage of smokers. Again, state regulatory environment ranks number 1 in Indiana, while as a state, when we look at infant mortality, we here in Indiana rank number 36. Looking at property tax index, Indiana fares very well, ranking number 5, while Indiana does not fare well when we look at cancer deaths, as the state ranks 43rd. Looking at Indiana from a state tax climate, again favorable at number 9, while overall health for Hoosiers ranks number 36. So here at Methodist, our objective is to assist in a number of ways to try to improve those healthcare rankings. Here at Methodist, we had almost 198,000 patient encounters in 2020. As you can see, it's made up of a number of things. Outpatient visits equating to approximately 124,000. Our emergency room saw over 54,000 visits. We had 12,337 inpatient admissions. We performed 3,882 outpatient surgical cases and almost 2,000 inpatient surgical cases. And we delivered almost 1,200 newborns. So a lot of activity within our communities. As mentioned earlier, Methodist is a safety net healthcare system. As you heard in our mission, it really is important for us to provide great healthcare services to all of those in need. In 2020, Methodist was able to generate $7.5 million of an operating margin. This operating margin allows us to reinvest into Methodist hospitals, and we do that in a number of ways. We reinvest into the facilities. We reinvest into technology to ensure that we have the latest and best technology to provide service to the community. And we reinvest into our services. And that can be comprised of our human resources and our purchase service or outside resources. So Methodist as a safety net organization generates about $410 million in net revenue on an annual basis, but approximately $402.5 million of expense, then leaving about $7.5 million as our operating margin. We have to use that $7.5 million in a very strategic manner, ensuring that we can provide great services for the communities that we serve. Speaking of the communities that we serve, let's go through some of the contributions that we here at Methodist make. When we look at our total economic and community impact, there at the center of the pie chart, it is approximately $706 million on an annual basis. That's a very significant number, and you can see in the dark blue, that's Methodist Hospital's economic impact, and in the lighter shade, that is Methodist Hospital's community impact. We make approximately $615 million of direct economic impact into our communities. Again, this is on an annual basis. and approximately 91 million of community impact. So in the economic impact, approximately 306 million come on spending within our healthcare system and or equipment, goods and services that we purchase. 234 million, again, is the impact of dollars through our human resources, our Methodist employees. As you can see, if we look at the community impact, you can see that we spend approximately 71 million on uncompensated and charity care. And I want to talk about our community commitment. Here at Methodist, this is extremely important to us. On the left side, this is baby Lauren. Baby Lauren was one of our tiniest and most vulnerable patients here at Methodist. And I'm very happy to inform you that today, she's a very healthy and strong young girl, and I'm proud of our organization and the role that we played in her success. On the right, these are a couple of our nurses in the simulator lab working with baby Tori. This allows our nurses to feel confident in going through these simulations to ensure success. As I'm sure you're aware, the past 21 months has been a challenge for healthcare. This is no different here at Methodist hospitals. And we're very proud of our response during the COVID-19 pandemic. We truly have heroes here at Methodist hospitals, and I'm going to spend a few minutes going through some examples of those. If you can think back to the beginning of the pandemic, this was March 2020. Methodist was able to quickly respond to the needs of the community. We launched drive-through testing at both our North Lake and South Lake campuses. We opened up dedicated inpatient units to address the needs of our COVID patients. We established symptom screening and visitor restrictions within all of our entry points in our healthcare system. Again, we did this for the protection of our team members, the public, and the patients that we serve. Unfortunately, because of that initial wave, we had to suspend elective procedures. If you recall, throughout that stage of 2020, the crisis around the pandemic started to deepen. There were a number of uncertainties. We had a mask order here within the state of Indiana, and that mask order within our healthcare facilities still remains today. As mentioned earlier, our COVID units expanded. We termed those cohort units as a way to ensure that those COVID patients knew that we cared for them. We launched telehealth services within our urgent care facilities, our Care First locations, and our Methodist physician group offices. This was a way to allow us to take care into the community. And we gained access to a number of new treatments and medications related to COVID-19. We were able to bring in anti-monoclonal infusions, and we were able to stay up with the most recent treatments related to COVID-19. This has been a long haul. We've had a number of new surges that we've had to weather. Throughout that, we have worked to maintain the safety of our team members through ensuring proper PPE, or personal protective equipment, and ensuring that we had the supplies needed to take great care of our patients. We faced that continual challenge of caring for both COVID and non-COVID patients, and we've continued to work with our heroes and ensure that they know they're the most important asset of Methodist hospitals. And those heroes are our team members. I want to give a heartfelt thanks to the community for their support. On the screen, you'll see a number of examples of partners within our community. There are so many more that are not listed on this screen, and I apologize for that. But these partners have given us the ability and continue to give us the ability to serve the community. So I want to again say thank you for that support. The photos listed here are our actual heroes in the organization, and some of the notes, gifts, and meals that they received and have received throughout this. Please continue to keep our healthcare heroes in your thoughts and prayers. At Methodist, we're extremely proud of our COVID-19 vaccine response. We were able to begin providing vaccines day one. That day was December 16th, 2020. Today, we've provided more than 60,000, and in fact, we're now closing in on 70,000 vaccines. We currently have 5 vaccination sites open: our North Lake campus, our South Lake campus, and the 3 Care First immediate care centers that you see listed: Cherville, Crown Point, and Maryville. Happy to report that at all 5 of those locations today, walk-ins are welcome, and those walk-ins can be for first dose, second dose, and/or now booster shots. We're also pleased to report that within our North Lake and South Lake campuses, that we provide pediatric vaccinations. Those are for our community members that are at ages 5 through 11. Our adult doses are for our community members age 12 and up. I encourage you to please consider vaccination, and once you consider that vaccination, please look to Methodist as your partner in providing that. We know the importance of vaccinations here at Methodist, and we've created a program. The program is I Didn't Hesitate to Vaccinate. Here are some pictures of our Methodist team members who received their vaccinations. We encourage photos with our I Didn't Hesitate to Vaccinate signs, and we encourage that positive promotion throughout social media. I again want to thank our Methodist family. We are one Methodist. Together we have weathered this COVID storm. Together we will meet the challenges of the future, and we thank our staff for all that they do each day for their patients and for each other. We love our Methodist staff. And as you can see, our heroes wear PPE. Now let's talk about some upcoming programs. Here at Methodist, we continue to look for ways to expand our reach beyond the 4 hospital walls. As mentioned throughout today, we're looking to expand and extend the Care First network. We're going to continue to promote and look for ways to expand telemedicine. Today we're doing that with some additional telepsych and telestroke programs, in addition to the ones I mentioned earlier. We're going to continue to look for community and physician partnerships. Community partnership that we were excited to announce in 2020 was with the town of Maryville, the Dean and Barbara White Community Center. As you'll see, Methodist Hospitals is the key sponsor in the exercise facility, and we were really happy to partner with the town and with the center. This is now Methodist and its employees' home. In addition, we have some partnerships with the University of Chicago. I've already mentioned the partnership around the cardiothoracic surgical program. We're partnering in telestroke, and we'll look at other opportunities upcoming in 2022. We're looking to expand our tertiary care capabilities. You heard about our expansion of our robotic surgical program, our new Gamma knife, and we have exciting new opportunities with new healthcare technology here in 2022. We plan to make capital investments over the next 5 years of $100 million. This $100 million will go into important capital and technology for our healthcare system. And you've seen how that then pushes the economic engine here in Northwest Indiana. And I'm excited to announce, and I'm excited to let you know we continue on as an independent healthcare system here in Northwest Indiana. Here at Methodist, we will always lead with our mission of preserving and improving human life, because that is what gives us credibility. We follow with a focus on safety, quality, and service, and we finish with accountability. Let's all remember, hope is essential.